Hello, I am Dr. Linda Parker. When a sudden spike in blood pressure hits after 65, it doesn't just shake the body. It shakes the soul. It steals your breath, tightens your chest, and reminds you in the most terrifying way that life is fragile, precious, and unpredictable. And in that moment, you think about the years behind you. You think about the people who still need you, the memories you still want to make, and the mornings you still want to wake up to. You think about your children, your partner, your grandchildren, those little faces that light up when you walk into the room. A blood pressure spike feels like the universe grabbing your shoulders and saying, "Stay here. Fight for your life. Take the steps that could save you right now." And the truth is, your body is not failing you. It is warning you. It is begging you to listen. Because even after 65, even after years of stress, loss, triumph, and survival, your heart is still strong enough to keep going if you give it the chance. In that urgent moment, your goal is not to panic. Your goal is to take control, to ground yourself, to protect your heart until help arrives, and you can. When a blood pressure spike hits, especially after 65, the very first battle is not inside your arteries, it is inside your mind. Panic is the invisible fuel that turns a manageable spike into a dangerous crisis. In that moment, your heart is already working harder than it should. Your vessels are already under pressure. Your body is sending signals: tightness, heat, pounding, dizziness, and every one of those sensations can trigger fear. But fear is the enemy. Fear pushes your heart to beat faster. Fear tightens your muscles. Fear makes your breathing shallow and rapid, sending a rush of adrenaline through your system that drives your blood pressure even higher. That is why the greatest emergency step you can ever take is to calm your inner world before you try to fix the outer one. Staying calm is not weakness. It is a form of survival. It is the skill that protects your brain, your heart, and your life. And it begins with one simple, powerful tool: your breath. Your breath is the emergency brake your heart desperately needs in those moments. When you slow your breathing, you tell your nervous system, "We are safe. We are in control." And your body listens. It responds. Your blood vessels slowly begin to release their grip. Your heart reduces its pace. Your brain regains clarity. Your thoughts stop racing and start organizing. But to reach that point, you must understand that breath is not just inhaling and exhaling. It is communication. It is a message from your mind to your body that tells it whether to fight, flee, or calm down. And in a blood pressure spike, calm is your lifeline. So begin by grounding yourself. Sit down if possible, never lie flat, because lying can make breathing feel heavier. Place both feet on the floor. Keep your back supported. Rest your hands loosely on your legs. This posture, Sigbar N, ALS stability. Then, close your eyes if you can, not tightly, just enough to shut out the world and focus inward. When a spike hits, your thoughts may feel like they are spiraling, jumping to every worst-case scenario you've ever feared. But in this moment, allow yourself to shift your attention to the one thing you can fully control: the air moving in and out of your lungs. Take a slow breath in through your nose. Not a big breath, just enough to feel your chest rise gently. Count to 4 as you inhale, then pause for a second, letting the oxygen settle. And exhale even more slowly, counting TBRO 6 or 7. The exhale is the key. The slow release tells your brain to shut down the panic response. It turns off the alarm bells inside your nervous system. It signals your body to begin repairing instead of reacting. Repeat this rhythm. Inhale for 4, exhale for 6. Do it again and again, EBR 8 times, 10 times, 12 times, until your shoulders begin to loosen and your heartbeat stops pounding in your ears. It won't fix everything instantly, but it will bring your body back from the edge. And after 65, this is the difference between danger and safety. You must remember something very important. Panic is natural, but it is not helpful. Fear is understandable, but it is not your friend in this moment. And the truth is, controlling your breath is one of the most effective ways to lower blood pressure quickly. You don't need equipment. You don't need medication in that moment. You need strength or speed. You just need presence. You need intention. You need breath. As your breathing stabilizes, you will feel your mind settle. You may notice the dizziness fading, the heat calming, or the tension easing in your shoulders and jaw. Your thoughts will become clearer, allowing you to decide your next steps without desperation clouding your judgment. And this matters deeply because, after 65, confidence in handling emergencies determines your safety. When you know how to stay calm, you reduce the likelihood of complications, you reduce the risk of stroke, you reduce the STR rain on your heart. You regain control of your own life in a moment that feels like chaos. Breath is the anchor that holds you steady until the storm passes. And the more you practice this in everyday life during stress, during frustration, during moments of overwhelm, the more natural it becomes during a real emergency. So when that spike hits, do not surrender to fear. Do not let panic lead the moment. Choose your breath, choose calm, choose your life. Because the truth is, your breathing can be the difference between your blood pressure spiraling or settling, between chaos or clarity, between danger or safety. And you are stronger, wiser, and more capable than you think, especially when you stay calm and breathe with intention. When a sudden spike in blood pressure strikes, especially after the age of 65, your first instinct may be to freeze or panic, but your body needs the exact opposite. It needs space. It needs oxygen. It needs relief from anything that puts extra strain on your heart. And that begins with something so simple, yet so powerful: how you position your body in the very first moments of the crisis. Sitting upright may feel small, but in that moment, it is an act of protection. When you sit up straight, you allow your lungs to expand fully, giving your heart the oxygen it needs to stabilize. Lying flat, on the other hand, can make breathing more difficult, and it forces your heart to work harder to pump blood against gravity. Gravity becomes your ally when you re-upright. It pulls blood down toward your legs instead of allowing it to surge toward your heart and brain. This reduces the internal pressure your cardiovascular system is fighting against, and it can be the difference between a mild episode and a dangerous event. Once upright, the next crucial SBR step is to remove anything that restricts your neck, chest, or abdomen. Tight collars, belts, waistbands, and even snug bras can put subtle but significant pressure on your blood vessels, lungs, and diaphragm. After 65, even mild compression can increase the body's workload. When the blood pressure is already elevated, every ounce of tension makes things worse. Loosening clothing frees your chest to expand more naturally with each breath. It helps the diaphragm move smoothly, letting you inhale deeper and exhale longer without resistance. These are more than comfort adjustments, they are emergency interventions that support your body's ability to stabilize itself. The goal is simple: reduce cardiovascular load. That means doing everything possible to lighten the heart's burden. And the most direct way to do that without medication, without equipment, without assistance, is through slow, controlled breathing. Slow, deep breaths are not just calming, they are physiologically corrective. When you inhale deeply, you bring oxygen into your bloodstream. But the true power lies in the slow exhale. A long, steady exhale activates the parasympathetic nervous system, the body's built-in calm WN switch. This system reduces heart rate, relaxes blood vessels, and decreases the force with which your heart pumps. In other words, slow breathing gives your heart room to recover. To do this effectively, place one hand on your abdomen. Feel it rise as you inhale gently through your nose for a CBR count of 4. Feel it fall slowly as you exhale for a count of 6 or even 8. Don't force it. Don't rush. Let each breath melt tension away from your shoulders, your jaw, your chest. With every slow exhale, imagine releasing pressure from inside your body. As your breathing steadies, your blood vessels begin to relax. Your muscle tension decreases, the pounding in your chest softens. Your thoughts stop racing. Your body's internal alarm system, which initially triggered the spike, begins to power down. This is not just emotional relief. It is measurable, physiological change. Older bodies, EBR, especially after 65, respond beautifully to slow breathing because the cardiovascular system becomes more sensitive to stress signals. That sensitivity works both ways. Panic can worsen symptoms quickly, but calm breathing can improve them just as powerfully. Sitting upright ensures your lungs can work optimally. Loosening clothing removes unnecessary pressure, Slow breathing activates your body's natural stabilizers. Together, these steps form a protective shield around your heart. These actions also prevent you from making instinctive mistakes like lying down flat, slumping forward, or holding your breath, each of which can worsen a spike. One of the greatest challenges in a blood pressure emergency is the feeling of losing control. But these physical adjustments give you something to focus on. They give your mind a job. They tell your body, we are not helpless, we are responding, we are taking control. And that matters profoundly. The human body, especially the heart, responds to intention. It responds to clarity, it responds to courage, and after 65, your body still listens to you, it still fights for you, it still wants to protect you. These steps may seem simple, but they are deeply strategic. They buy you time. They protect your organs from acute stress. They stabilize your body while you decide your next move, whether you alert someone, take prescribed medication, or prepare to call emergency services. You aren't just sitting upright. You repositioning yourself for survival. You aren't just loosening clothing. You refreeing your heart from unnecessary strain. You aren't just breathing slowly. You relowering the internal pressure that threatens your health. In those moments when your body feels overwhelmed, remember this: you are not powerless. You have tools within you, your posture, your breath, your awareness that can guide your body back to safety. And each time you practice these steps, you reinforce your strength, your resilience, your will to keep living the life that still belongs to you. When a blood pressure spike strikes after 65, it can feel like your body is waging a silent war inside you, a battle you didn't see coming, a battle you never asked for. At first you may try to stay calm, breathe, sit upright, loosen your clothing, and often these steps help your body regain some stability. But there are moments when the symptoms settle moments when the pressure rises instead of falling, when the pounding in your head grows heavier, when dizziness turns into confusion, when chest tightness refuses to ease, when your heartbeat feels irregular, aggressive, or frighteningly fast. And this is the moment that defines survival, the moment when you must not hesitate, must not second guess, must not try to wait it out. Because if the symptoms worsen, if they become stronger, sharper, or more alarming, your next step is the one that may save your life. Calling emergency services immediately. People often underestimate how quickly a blood pressure spike can escalate. After 65, your arteries are more sensitive, your heart works harder, and your brain is more vulnerable to fluctuations in blood flow. A severe spike is not just a discomfort, it is a warning sign that your organs are under intense stress. When the numbers surge high, the fragile vessels in your brain can rupture, causing a stroke. The heart, overwhelmed, can lose rhythm, suffer damage, or go into failure. And these events do not announce themselves gently. They happen fast, silently, and often without giving you a second chance. That is why rapid intervention matters. Emergency professionals have medications, equipment, and expertise designed specifically to stop these crises before they cause irreversible harm. They can lower your blood pressure safely, monitor your heart rhythm, assess your neurological signs, and act within minutes that make the difference between recovery and tragedy. Calling emergency services is not overreacting. It is not being dramatic. It is honoring your life. It is protecting your brain from stroke. It is preventing your heart from being pushed beyond its limits. It is giving yourself the chance to see tomorrow. Far too many people hesitate, thinking, maybe it will calm down, or I don't want to bother anyone, or I'm sure it's nothing serious. But your life is always serious. Your health is always worth the call. And the truth is, emergency responders prefer being called early rather than acing a crisis too late. You must understand that symptoms worsening is your body begging for help, not later, not after you've rested, not after you've tried home remedies, but right now. If your vision becomes blurry or dim, if one side of your face or body feels weak, if your speech becomes slurred, these are red flags of an impending stroke. If your chest pain intensifies, if it spreads to your jaw or arm, if you feel nauseous or clammy, these are signs of potential heart distress. If your breath becomes tight or shallow, if you feel like you might faint, if confusion or disorientation takes over, these indicate that your brain is no longer receiving steady blood flow. In all these situations, calling emergency services is not just recommended, it is essential. After 65, every minute counts more. Your heart and brain cannot afford delays. The precious moments between worsening symptoms, ABRND medical intervention create a window of vulnerability. Closing that window quickly is what protects your future. And there is something else. When you call for help, you are not just acting for yourself. You are acting for the people who love you. For the family that depends on your presence. For the faces that would break at the thought of losing you. You are choosing to stay. You are choosing to fight. You are choosing the chance to continue your life's story. It is also important to prepare mentally for this possibility. Know your emergency numbers. Keep your phone easily accessible. Inform your family about your risk factors. Don't allow shame, hesitation, or fear to silence your instincts. Courage in these moments is not loud or dramatic. Courage is making the call even when you hope you need to. Courage is choosing life over uncertainty. And every time your symptoms worsen, courage must lead. Emergency responders are trained to handle these situations with speed and precision. They know how to stabilize you before complications occur. They know what to look for, what to monitor, what to treat, and how to protect your brain and heart from damage. They are not a last resort, they are the lifeline you deserve. So if the pressure rises instead of falling, if your body feels like it's slipping out of your control, you must act without delay. Your life is too precious to gamble on hope alone. Call, ask for help. Let trained hands take over when your body is overwhelmed. Rapid intervention prevents stroke. Rapid intervention protects your heart. Rapid intervention gives you the time and strength to recover fully. And in moments like these, time is the single greatest gift you can give yourself. In the end, what truly saves a life in a blood pressure emergency is not luck, not chance, not hoping the moment will pass. It is the courage to act, the wisdom to listen to your body, and the love you have for the life still ahead of you. After 65, every heartbeat carries the stories you've lived, the people you've raised, the battles you've fought, and the memories you still want to create. A sudden spike in blood pressure is not a sign of weakness. It is a call to protect everything that matters to you. When you stay calm, sit upright, loosen what restricts you, breathe slowly, and seek help the moment symptoms intensify. You give your heart its best chance. You give your brain the oxygen it needs. You give your body time to steady itself. Most importantly, you give yourself the opportunity to keep living with strength, clarity, and purpose. You are not fragile. You are not alone. You are someone who has survived decades of life, and you deserve many more. Hober nor your body. Trust the steps that protect you. And remember, the fastest way to safety is choosing not to wait. Your life is worth that call.